Hey everyone, and welcome back. Today we're taking your requests for a deep dive and really unpacking marijuana.
It's definitely a hot topic, lots of people talking, lots of opinions.
Yeah, and it seems like everybody's got a different slang for it too. Our research turned up dope, weed, Mary Jane, even grass.
Right. It speaks to how widely used it is, even just the number of nicknames. And, that actually brings up an important distinction we should make right off the bat. We see cannabis and marijuana used kind of interchangeably a lot.
Yeah, like they're the same thing.
Right, but they're not exactly. So cannabis is more like the plant itself, which includes hemp. But marijuana is specifically the stuff that gets you high, the dried leaves, flowers, and all that.
So when we're talking about getting high, it's the THC in marijuana that's doing it, right?
Exactly. And it's mostly in those dried flowers and leaves. That's where the THC is concentrated. Now, this is going to surprise some people. Marijuana is actually used more than tobacco is here in the U.S.
Well, seriously, I did not know that. More people smoking weed than cigarettes. That's wild.
Millions and millions of users.
Wow. Well, that kind of brings us to the big question then, doesn't it? Like, with that many people using it, is marijuana actually addictive?
Oh, that's a loaded question. The short answer is yes, it can be. B-U-T.
But there's always a but, right?
Right, because it's not as simple as some people make it seem. Only a small percentage of marijuana users will actually become addicted, like truly dependent.
Okay, so it's not a guarantee that if you light up a joint, you're automatically hooked.
Not at all. Studies put it around 9% of users developing a real dependency.
9%, so not nothing, but...
But here's the kicker. That number jumps way up for people who start young. Like if you start using marijuana as a teenager...
Oh, that's when it gets riskier.
Way riskier, yeah.
Yeah.
We're talking a 1 in 6 chance of becoming addicted if you start in adolescence. Big difference.
Wow, 1 in 6, that's huge. So I guess it would be really important then to know what to look for. Like, what are the signs that someone might have a problem with marijuana?
You're telling me.
Yeah.
Early intervention can make all the difference. And one thing to remember is that marijuana addiction, like any addiction, can be sneaky. It's not always as obvious as someone being stoned out of their mind 24/7.
Okay, so what should we be looking for then? What are the red flags?
So one biggie is if someone just can't seem to function without marijuana. Like they need it just to get through the day and it starts affecting their job, their relationships.
Responsibilities fall by the wayside.
Exactly. Another one is withdrawal. If someone tries to cut back or quit and they get super irritable, can't sleep, have intense cravings.
That's a sign that it's not just casual use anymore.
Right. It's like the difference between enjoying a beer with dinner and needing a drink just to get out of bed in the morning. Big difference.
Huge difference. So we're talking about addiction, but what are the actual risks here? Like, why does it matter if marijuana is addictive?
Well, that's a whole other can of worms. Or should I say, a whole other bag of...
Let's stick with can of worms for now, but that's a perfect question and one we are going to dig into right after the break. Now, with marijuana becoming legal in more places, there's this idea floating around that it's totally harmless.
Right, like it's completely risk-free.
Yeah, but from the research we've looked at, it seems like long-term use, especially heavy use, can actually have some pretty serious consequences.
Yeah, it's not something to mess around with. And we're talking about both physical and mental health here.
Okay, so let's break that down a bit. What are we talking about specifically? What kind of health risks?
Well, for starters, let's talk about your lungs, right?
Mm.
I mean, smoking in general isn't exactly good for you. And with marijuana, one study we saw found that people who smoked it regularly were 3 times more likely to develop chronic bronchitis than non-smokers.
3 times, that's a lot.
It is. And it makes sense when you think about it because marijuana smoke, just like cigarette smoke, has all these nasty substances in it that can irritate your lungs.
So even though it's, a plant, it's still not good to be inhaling that smoke.
No, not at all. It's not just about it being natural or not, it's the mechanics of it, the stuff you're putting into your body.
Makes sense.
And it's not just your lungs either. We're also talking about heart health. Marijuana use can make your heart race, elevate your blood pressure.
Oh, so if someone already has heart problems, that's got to be bad news.
Yeah, it can significantly increase the risk of things like heart attacks. And then, of course, there's the brain. You mentioned earlier how young people might be especially vulnerable when it comes to addiction.
Right, because their brains are still developing.
Exactly. And there's more and more research coming out showing that if you use marijuana heavily during adolescence, it can really mess with that development.
What kind of problems are we talking about?
Well, for one thing, it seems to be linked to a higher risk of developing certain mental health disorders later on. We're talking depression, anxiety, even psychosis in some cases.
Oh, wow. So it's not just about getting high. It could have these long-term mental health consequences.
It can, yeah. And it's not just about the risk of developing a disorder either. There's also the impact on your everyday brain function. Like, studies have shown that if you're a heavy marijuana user as a teen, you might have more trouble with memory, attention, learning.
Really? So it's harder to think straight, basically.
In a nutshell, yeah. Like
Ugh.
your brain is still under construction and you're kind of messing with the blueprints.
Wow, that's a good way to put it. So, not great. But let's say someone's listening to this and they're thinking, okay, this is freaking me out. I think I might have a problem. What can they do about it?
That's a great question. And the good news is there are things you can do. Just like with any addiction, there are effective treatment options out there. It's just about finding what works best for you.
So, what are the options? Our research mentioned something called inpatient rehab, and then there's outpatient. What's the difference?
Okay, so inpatient is basically the most intensive type of treatment you can get. It usually means you're checking yourself into a facility where you're living full-time.
So, you're really immersed in the recovery process.
Totally. And they give you 24/7 care and support. This is usually what's recommended for people who have a really severe addiction, or maybe they've tried to quit on their own and it hasn't worked, or if they're dealing with other mental health issues at the same time.
Makes sense. So, it's like hitting the pause button on your life and really focusing on getting better.
Yeah, exactly. Now, outpatient is a little different. You're still going to therapy and support groups and stuff, but you get to live at home.
So, it's more flexible.
Way more flexible, yeah. This can be a good option for people who maybe don't have as severe of an addiction, or they've got a really strong support system at home, or they just can't take a ton of time off work or family stuff.
I guess the tricky part with outpatient, though, is that you're still surrounded by all those triggers in your everyday life.
Oh, absolutely. You have to be super motivated and disciplined to make it work.
Right. Okay, so whether it's inpatient or outpatient, what are some of the specific things that people do in rehab to actually overcome marijuana addiction? What does that look like?
Well, one thing that comes up a lot in the research is behavioral therapy, specifically something called cognitive behavioral therapy, or CBT.
I've heard of CBT, yeah. What is it exactly, and how does it work for addiction?
So basically, CBT helps you identify those negative thought patterns and behaviors that are contributing to your addiction.
So, like those cravings that hit you out of nowhere.
Exactly. And it gives you the tools to actually change those thoughts and behaviors.
So it's like rewiring your brain to break free from those addictive patterns.
That's a great way to put it. It helps you develop healthier coping mechanisms and strategies for dealing with cravings and triggers.
And it's not just about therapy either, right? Our research also mentions support groups as a valuable resource.
Absolutely. Support groups like Marijuana Anonymous, MA, and Narcotics Anonymous, NA, provide a safe and supportive space for people in recovery to connect with others who understand what they're going through.
Makes sense. Like sometimes you just need someone who gets it.
For sure. They offer peer support, guidance, and encouragement, which can be incredibly helpful in maintaining long-term sobriety.
It's like that saying, it takes a village. Having a supportive community can make all the difference.
It really can. And for those who need a little extra support, transitioning back to everyday life after rehab, our sources mentioned sober living environments as another option.
So these are places where people can live in a drug-free, supportive environment while they're getting back on their feet.
Exactly. They provide structure, accountability, and a sense of community, which can be crucial during those early stages of recovery.
It sounds like there's a whole network of support out there for people who are ready to break free from marijuana addiction.
There is. And the most important message to convey is that no one has to go through this alone. There is help available, and recovery is possible.
That's really important to remember. So to recap, we've gone from slang terms for marijuana all the way to treatment options for addiction. That's a lot of ground covered.
It really is. And I think the biggest takeaway here is that marijuana is complex. It's not just good or bad. It has potential benefits and risks, and it affects everyone differently.
And as with anything else, knowledge is power. The more we understand about marijuana, the better equipped we are to make informed decisions about our own health and well-being.
Absolutely.
Well said. That wraps up our deep dive into the world of marijuana. Until next time, stay curious, and thanks for listening. So CBT is like rewiring your brain to break free from those addictive patterns.
That's a great way to put it. It helps you develop healthier coping mechanisms and strategies for dealing with cravings and triggers.
And it's not just about therapy either, right? Our research also mentions support groups as a valuable resource.
Absolutely. Support groups like Marijuana Anonymous MA and Narcotics Anonymous NA provide a safe and supportive space for people in recovery to connect with others who understand what they're going through.
Yeah, it's like sometimes you just need to talk to someone who gets it.
Exactly. They offer peer support guidance and encouragement, which can be incredibly helpful in maintaining long-term sobriety.
It's like that saying, it takes a village. Having a supportive community can make all the difference.
It really can. And for those who need a little extra support transitioning back to everyday life after rehab, our sources mentioned sober living environments as another option.
Oh, okay, so these are places where people can live in a drug-free, supportive environment while they're getting back on their feet.
Exactly. They provide structure, accountability, and a sense of community, which can be crucial during those early stages of recovery.
It sounds like there's a whole network of support out there for people who are ready to break free from marijuana addiction.
There is. And the most important message to convey is that no one has to go through this alone. There is help available and recovery is possible.
That's really important for people to hear. So to recap, we've gone from slang terms for marijuana all the way to treatment options for addiction. That's a lot of ground covered.
It really is. And I think the biggest takeaway here is that marijuana is complex. It's not just good or bad. It has potential benefits and risks, and it affects everyone differently.
Exactly. And as with anything else, knowledge is power. The more we understand about marijuana, the better equipped we are to make informed decisions about our own health and well-being. Well said. Well, that about wraps up our deep dive into the world of marijuana. Until next time, stay curious, and thanks for listening.